I just want to welcome everyone tonight to our Medicare Expansion Forum. We're so excited that you're here. I'm Jerry Katz, I'm M&A staff. I'm just going to give you a couple of pieces of information before we get started here tonight. We have a pretty big group with us, which is wonderful, and we just want to ask so that everyone is able to hear to please keep yourself muted. We will take some questions after each of our presenters, so please put your questions in the chat, and then we will call those questions off as we go after each presenter. We have three speakers tonight. So we have Rose Roach, who is the Executive Director of the Minnesota Nurses Association. We have Amirah Sequeira, who is the Legislative Advocate for National Nurses United. And we have Jasmine Ruddy, who is the Medicare For All organizer for National Nurses United. So it's an all-star cast. I'm going to kick it over to Rose to welcome everyone tonight. Thank you.
You bet. Thank you, Jerry. So good evening and greetings of health to you all from your nurses. So speaking of health, wouldn't it be wonderful and won't it be wonderful when expanded and improved Medicare for All is the healthcare system of our country? We all know that that's what we're here for and that's what we want. But we also know that the movement to demand that system is still building and there is more work to be done to make that our reality. However, the exciting news is that there is a proposal being considered right now that requires our attention as activists and advocates for Medicare for All. It's a proposal that doesn't quite get us the for all part just yet, but it does get us the expanded and improved part. So as you listen to our amazing presenters tonight, and seriously, these are two of the best and brightest that this nation has to offer. I want you to be thinking about these 5 questions. Number 1, would this proposal strengthen the social insurance model? Number 2, would this proposal help to decommodify healthcare? Number 3, would this proposal move us closer to Medicare for All? Number 4, would this proposal help us build power and bring in new allies? And finally, number 5, would this proposal help to weaken and divide the medical industrial complex and their allies? This is important for us to consider because we in the healthcare justice movement, and rightfully so, are leery a lot of times when we hear about what we would call incremental change to our healthcare system. But these questions can really help us evaluate the proposal that is going to be presented tonight, and we're going to be discussing that more afterwards. So I'm going to revisit these questions with you following our speakers' presentations as we think about why and how we need to make the proposal part of the American Families Plan. So with that, I'm going to turn it back over to Jerry to introduce our exceptional speakers.
All right. So first off, with a summary and analysis of the legislation itself that we are talking about tonight, we have Amirah Sequeira from National Nurses United. Go ahead, Amirah.
Thanks so much, Jerry, and thank you, Rose, for inviting me to be a part of this. Hello, brothers and sisters. It's great to see you. Always great to be with our friends, our colleagues at the Minnesota Nurses Association and all of their wonderful allies in the state of Minnesota. So like Jerry said, my name is Amirah. I'm the lead legislative advocate for National Nurses United in DC. So I'm the person who leads all of our federal legislative work on Capitol Hill. And like Rose said, we have a really exciting opportunity right now, like in the coming weeks, like in the next week, 2 weeks, 3 weeks, up to maybe 2 months to win what may end up being one of the most exciting and impactful healthcare expansions that we've seen in recent years. So the opportunity we have is to improve and expand the Medicare program. So this would not be winning Medicare for All, but it is an opportunity to win critical steps on the path to Medicare for All. What we're talking about is winning things that are in our Medicare for All bill, not winning the whole thing, but winning segments of it that will improve healthcare for tens of millions of older Americans and could potentially expand Medicare and give healthcare in a single payer system to more people than currently have it through the Medicare program. So there are really three things that we have the chance to win. The way that we will win them is through this process called budget reconciliation. I'd imagine many of you have been hearing about this in the news. There was a budget reconciliation process that happened earlier this year with the COVID package led by Chairman Bernie Sanders of the Budget Committee. This will be the second budget reconciliation package that happens in the Biden administration since January of 2021. And the reason we can win things in budget reconciliation is because right now, as you probably know, the Senate is a 50-50 split, which means Democrats can barely pass anything into law. But if they pass things through budget reconciliation, they only need a 51 vote. And so with 50 Democratic senators and the vice president, they can pass key things through budget reconciliation. But anything that goes through budget reconciliation has to have an impact on the federal budget. The good news for us is that anything that has to do with Medicare has an impact on the federal budget. So here's what we're talking about. We're talking about three proposals that are on the table right now. None of them are guaranteed. I'm going to talk about them in order of most likely to win to least likely. So the first thing is Medicare drug price negotiation in order to lower the cost of drugs. So right now, as all of us know, drug prices in this country are too high. People die every day because they can't afford the cost of their prescription drugs. Nurses, those of you on this call, sisters and brothers who are nurses on this call, healthcare workers across this country can tell you about patients every day who don't buy the prescription medications they need because they can't afford it, or who ration their medications and then end up more sick and sometimes endangering their lives because they can't afford those medications. 1 in 5 Americans doesn't fill a prescription that they need that has been prescribed by their doctor because they can't afford it. From 2008 to 2015, the price of brand name drugs increased by 164%, which is insane. The price of nearly 400 generic medications increased by more than 1,000%. The way that the cost of prescription drugs are increasing is unsustainable, and it is not working for patients. It's working for drug industry profits. Now, the Medicare program, those of you who are over 65 likely are using Medicare as your healthcare insurance provider. And Medicare does not negotiate the cost of prescription drugs, which means that Medicare, when Medicare's is the way that Medicare drug pricing works, there's no negotiation with prescription drugs, which means pharmaceutical companies can charge Medicare and you, the patients, as much money as they want. That is insane. Every other rich nation in this country has a single-payer universal healthcare system where they negotiate the prices of prescription drugs so that the prices come down. If we were to win drug price negotiation in the Medicare program, we would lower the amount of money that Medicare pays on prescription drugs. We would lower the amount of money that people receiving Medicare, older Americans, and some people with disabilities, the amount they're paying out of pocket for prescription drugs. And we can apply those negotiations to all other health plans, which means all of us who aren't on Medicare, the cost of our drug prices will go down as well. So that is the first thing that we can win. If we were to win Medicare drug price negotiation, in the proposal that was passed in the House of Representatives last session, Medicare could save somewhere along the lines of $456 billion over the course of 10 years. That money would then be available to put back into the Medicare program to improve the Medicare program. So the first thing we want to win is Medicare drug price negotiation, not only to improve the cost of prescription drugs for Medicare recipients and the Medicare program for older Americans, the Medicare program, but also extending that to apply to the rest of the country. That's proposal number one. Proposal number two is to improve Medicare benefits. So as many of you know, when we talk about Medicare for All, we don't just say we need to improve the Medicare program as it stands today. Expand the Medicare program as it stands today. We talk about how we need to improve it first, because right now traditional Medicare doesn't cover dental, vision, and hearing, and also it doesn't negotiate the cost of prescription drugs, and prescription drugs are really pricey under Medicare. So we could cover dental, vision, and hearing under the current Medicare program in traditional Medicare for somewhere around $358 billion over 10 years. What would we get if we did that? Well, right now, over 70% of senior citizens of older Americans have no dental insurance, and the results of that are absolutely tragic. 70% of older Americans have gum disease. Gum disease can lead to really severe illness like rheumatoid arthritis, like cardiovascular disease. Half of senior citizens have not been to the dentist in over a year, and about 20% have untreated cavities. These are really, really problematic, really dangerous things that are happening because older Americans don't have dental insurance because Medicare doesn't cover dental. So we add dental, we are going to deeply improve the healthcare that our older Americans are receiving in this country. Hearing. Half of all adults over the age of 75 in our country have hearing loss. For people ages 65 to 74, the Medicare age before 75, 1/3 of those adults have hearing loss, but more than 70% of older Americans who could benefit from a hearing aid do not have one because hearing aids are too expensive and Medicare doesn't cover them. So you're seeing this number, 70%, come up multiple times. That's what we're talking about here. 70% of older Americans not having healthcare, critical healthcare that they need because Medicare doesn't cover it. It's similar for vision. Older Americans with poor vision should not be forced to go without routine eye exams or without eyeglasses because of the cost, which is what is happening now. And we know that when someone has difficulties with vision, those difficulties can lead to disability, they can lead to cognitive impairment, they can lead to depression with ongoing vision problems. These are really critical aspects of healthcare. And so for $358 billion over the course of 10 years, we could expand Medicare, improve Medicare so that it covers dental, vision, and hearing, and drastically improve healthcare for all of these older Americans who don't have those services right now. Just to say, this is part of our Medicare for All bill. In the Medicare for All bill, one of the things that happens is we improve the Medicare program to cover dental, vision, and hearing. Another improvement we would like to make to Medicare is to implement an out-of-pocket cap. So right now, older Americans in this country, they're trying to survive on about $2,200 a month. Right now, there is no out-of-pocket spending cap on traditional Medicare. This is part of why people use Medicare Advantage plans, which are private insurance plans through Medicare. That and the fact that they might cover dental, vision, and hearing when traditional Medicare doesn't. At the moment, under our current healthcare system, there's an out-of-pocket cap for Medicare Advantage plans and for the Affordable Care Act, plans through the Affordable Care Act, but Medicare doesn't have one. So senior citizens are ending up with these massive healthcare bills that they can't afford to pay when they're living off of something like $2,200 a month. So all of these improvements in the second bucket are critical to improving healthcare for older Americans. They're also really important politically because we want to win Medicare for all. And so if we improve Medicare, Medicare keeps getting better, it's going to help us to expand it over the coming years. So there's a third last proposal on the table, and that is to expand Medicare by lowering the age. So President Biden, during his campaign, committed to lowering the age of Medicare to age 60. Now, many of us, obviously, we support Medicare for All. We want to see Medicare's age, there not be an age. We want it to see it cover everybody. There are really strong arguments to, instead of reducing the age to 60, to lower it all the way to 50, 55 or 50. But it seems like if anything is possible, it's lowering the age to 60. So a few things. The uninsured rate for adults ages 50 to 64 is 10.5%. During COVID, Americans in that bracket, the 50 to 64 bracket, approaching retirement, have faced significant job loss because of the recession brought on by the pandemic. And they are particularly disadvantaged in states that have refused to expand Medicaid. And when they've lost their jobs, they've lost their employer-sponsored insurance, and they may not be able to get on Medicaid because those states may not have expanded Medicaid. We also know that from a healthcare provider perspective, there are a lot of increased health risks after the age of 50. We see this thing with, many nurses can tell you, where when people turn 65, there's this huge increase in cancer diagnoses and other diagnoses after people turn 65, not because they suddenly all get sick at 65, but because they haven't gotten preventive care to diagnose issues before they get on Medicare. So from a healthcare perspective, if we can lower the age, we will improve healthcare for millions of Americans. So right now, it is most likely that we will be able to win some level of Medicare drug price negotiation and some level of coverage of dental, vision, and hearing in Medicare through this budget reconciliation process. Senator Schumer, the majority leader of the Senate, has been tweeting out saying that he supports Bernie Sanders in improving Medicare to cover dental, vision, and hearing. That is a massive win. That is a really big deal. Speaker Pelosi really wants to win lowering drug prices and Medicare drug price negotiation. Lowering the age, there's a little bit less of a conversation on the Hill, but it's really important in this moment, in the coming weeks, up to in the next week, up to the next 2 months, that across the country, we are sharing our patient stories. We are sharing our stories if we're healthcare workers, if we're nurses. We are calling our senators and our members of Congress because there is actually a chance to win this. It is being talked about in leadership. The key committees, the Budget Committee, the Finance Committee in the Senate, in the House, the Ways and Means Committee, the Energy and Commerce Committee, who make these decisions, all of leadership, Chuck Schumer, Nancy Pelosi, Bernie Sanders, they are all talking about these three things. So there is a critical opportunity right now. And if we win, it won't be Medicare for All yet, but it will bring us closer to winning Medicare for All, and it will improve healthcare for tens of millions of older Americans, and hopefully bring in more people into the Medicare program. So I'm going to pause there because I believe my colleague Jasmine is going to be talking to you more about grassroots work that can be done in this moment. But once again, thank you so much for getting on this call. It's great to be with you, and a big thank you to Jerry and to Rose and to the Minnesota nurses for having us.
Amirah, before you mute yourself, we did have one question for you in the chat. Betty asked, I believe there was a political agreement perhaps put into law between the two major parties. Was this part of the Affordable Care Act, i.e. Obamacare? If so, would repealing that, even through a new bill, endanger the ACA's standing?
Betty, I'm not sure what political agreement you are referring to, so I'm not sure that I can answer that question. I would just say that I don't believe there is any way that improving the Medicare program would endanger the ACA's standing. It would just improve the Medicare program, which is separate to the ACA. And by negotiating drug prices, which by the way, the VA system already does, that would improve Medicare. It would save Medicare money. It would be better for the program financially. By adding dental, vision, and hearing, that's all separate to the ACA. What it would do is it would affect to some degree Medicare Advantage plans, the private insurance Medicare plans, which is a good thing, right? Because those don't work for seniors. So it would improve traditional Medicare, and you're going to see private insurance companies fight back against these proposals because they rely on the shortcomings of Medicare to bring seniors into paying for those private insurance plans.
So Amirah, Betty clarified in the chat, she's specifically talking about the prohibition on negotiating drug prices, and that predates Obamacare, doesn't it? That was
Yes.
2003, I think.
Yeah, so this has long been a part of the Medicare program. And like I said, it's like the other federal healthcare programs do negotiate drug prices. So this won't impact the ACAA at all. Although it will potentially, if the package is good enough, if the legislation is good enough, it may mean that ACA insurance plans and employer-sponsored plans that folks may be on will also see the benefit of those negotiations. So the hope is that if Medicare negotiates the drug prices for Medicare, that we will apply those negotiated drug prices for those drugs to all health plans across the country is what we'd like to do. Which I should just say, you know, the negotiating of drug prices under Medicare, that was passed by the House of Representatives in 2019 in a bill referred to as HR 3. It has really broad Democratic support in the House and the strong support of Speaker Pelosi. And Speaker Pelosi is very dedicated also to the preservation of the ACA. But she is really in support of negotiating Medicare drug prices.
Wonderful. Thank you, Amirah. Can we give Amirah a quiet Zoom round of applause? Thank you so much for that information. And now we're going to move on to hear from Jasmine Ruddy, who is going to tell us more about the path to win, because this is winnable. And we're really excited to hear, Jasmine, about the organizing that's happening around Medicare expansion.
Great. Thank you so much. I have some slides that I put together, if it's still okay for me to share my screen and share those. Okay, great. Okay, so let me go do that real quick here. And thank you everybody so much. Thank you, Jerry. Thank you, Rose and Minnesota Nurses for having us. It's really exciting to be here with you all tonight. And again, yeah, my name is Jasmine. I'm the lead Medicare for All organizer for the nurses, and really excited to talk with you all tonight. Now that you heard from Amirah about what these policies would do and a bit more in detail about what they are, I'm excited to talk to you about some of the organizing. Can you see my screen on the slide? Okay, great. Yeah, the first thing I want to do before I even jump into that is just recap, as Rose and Amirah both eloquently did, is that I think everyone here is on the same page. That Medicare for All is ultimately our real goal here, right? I don't think I need to remind anyone on this call, but just to re-ground ourselves in where we're at in this moment and how much worse the COVID-19 pandemic has made things, right? It's important that we don't let ourselves forget some of the most jarring statistics, right? That we have 29 million people in the United States who were uninsured before the pandemic. And we had 44 million people in the United States who were considered underinsured, right? Had insurance, but couldn't afford to use it because they couldn't afford copay, deductible, those sorts of things. And that was all before the COVID-19 pandemic, right? And over the last year and a half, we saw that get even worse, right? We saw our just how unstable and unsustainable our employer-based health insurance model really is. It was really put to the test in the last year and a half, and we know now more than ever that this system's really so truly unsustainable, right? Tens of millions more were thrown off their employer-sponsored insurance at a time when we needed people to be able to have healthcare the most in this country in a pandemic. Our capitalist for-profit healthcare system instead prevented millions more people from accessing the care that they need, right? So I think helpful to ground ourselves in just how much work we have to do, and that the nurses, at National Nurses United and Minnesota Nurses Association are continuing to do that work every single day. Although I'm excited to talk to you about this plan right in front of us right now to really get some major improvements and expansion if we fight for it, right? But Medicare for All is what we'll keep fighting for, right? Like I said, it's what the nurses of NNU and MNA have been, will continue fighting for. We're going to keep our eye on the prize. I want to say a congrats, by the way, to all of you in Minnesota who were involved in really exciting win recently, I think last month, right, to get Representative Betty McCollum to co-sponsor Medicare for All. So thank you if you were part of that. We're deeply appreciative to particularly the Minnesota nurses for that. Really grateful for your leadership and your work on that amazing campaign. And I also just want to make a plug, if you're not yet involved in Medicare for All organizing, I do really hope you'll get involved in Minnesota. If you want to join an end-use campaign, you can join our campaign by going to Medicare4all.org. So that's our eye on the prize, right? That's really where we need to get to. But again, as Rose and Amirah eloquently laid out, we have got a real concrete opportunity here in the next few weeks to win some pretty big and major improvements to Medicare. And we're like close to the finish line, right? What we really need is to carry this over. We're in the 10-yard zone and we need to carry this over, and we can get it done with the right organizing and the right work in the next few weeks. Amirah went over what those three things are really in depth, really eloquently. I just want to quickly recap them, just what they are for you, just the top line, just so that you can know again what these three things are. Real quick, again, number one, that is allow Medicare to negotiate prescription drug prices. As Amirah said, you might think Medicare was already able to do this. Unfortunately, you would be wrong. Medicare is not currently able to negotiate this, and it's crazy, right? We would save the federal government billions of dollars, and our seniors would save significantly if we get this done. So that's number one, allow Medicare to negotiate prescription drug prices. And as Amirah said, number two, improve Medicare to include hearing, dental, vision, and that out-of-pocket cap. I'm just going over these just so you can kind of remember the top lines, the messaging for how to talk about these things. So that's number two, right? And again, you might have thought Medicare already included hearing, dental, and vision, and unfortunately, you would be wrong. And for too many of our seniors who are on Medicare, they know all too well that Medicare does not include these things. Too many nurses on this call know all too well that for their patients, for their who are seniors on Medicare, these things are not currently included, and it is unconscionable that these things, these basic human rights, these basic medical needs are not included in Medicare today. So that's number two. We can get this in the next few weeks. And then number three, as Amirah said, lower that Medicare eligibility age from 65 down to 60. And of course, as Amirah also said, as Medicare for All advocates, as healthcare activists, we want that number to be 0, right? But bringing it down 5 years. In the next few weeks, we can get this done. Bringing it down 5 years, I want to emphasize this point, would bring 23 million more people into the Medicare program in the United States. 23 million more people. We can get that done right now, and that's a major step towards Medicare for All. This is perhaps the most significant and the most biggest thing we could win, the biggest number of lives that we could change if we could get this passed. I know many of you here might know someone in your lives, or maybe even you yourself, who is experiencing delaying retirement, or just to be able to qualify for Medicare, right? Between the ages of 60 and 65, we see far too many Americans holding off on their retirement just because they can't qualify yet for Medicare. We also know that particularly disproportionately, Americans in that age range of 60 to 65 who are doing this, who are putting off retirement to qualify for Medicare, disproportionately Black and Brown Americans. This would save lives, it would improve lives. Amirah noted the study from Stanford University that came out earlier this year that showed that cancer diagnoses in the United States spike at 65, not because people suddenly get cancer at 65, but because that's when they can get diagnosed. That's when they can see a doctor. We would save lives if we can bring this down. So those are the three, right? I want to take a second to just play a short video clip for you all from Senator Bernie Sanders' office. He's currently the chair of the Senate Budget Committee, and he's been really central to these negotiations. He's been central to really being out there trying to really champion these policies out in public and fight for them in these negotiations. And this video that his office put together gives a really compelling and powerful look at just a couple of personal stories of how these policies would change lives. So I'm going to play that video for us real quick. Let's see. Oh, it's not loading very well.
It is outrageous that millions of seniors have trouble eating because they can't afford dentures.
You know, when you've got just Social Security, it only goes so far, so you got to be pretty economical. It's exactly what it is picking priorities, and sometimes your teeth can't be your first one.
If Medicare was expanded to include dental coverage, eyeglasses, hearing aids, that would really improve people's quality of life and financial stability.
I got 2 teeth missing. I'd like to have. I couldn't afford to keep them because I didn't have $1,500, $1,600 to have them capped or a replacement for them, as far as that goes. And I got real heart troubles, which the teeth, if they're infected, it gives you a chance to get that infection in your bloodstream and kill you a little quicker. And I just think it's part of your health. And I think it needs to be addressed along with your hearing and your eyesight.
The one thing that is often lacking in insurance is prevention, that a relatively small amount of money for something like dental cleanings on a regular basis would be able to prevent people from needing $3,000, $4,000, $5,000 dentures.
There is growing support to at least right now expand Medicare to cover dental, to cover hearing, to cover eyeglasses.
People are still driving with the glasses they got 10 or 15 or 20 years ago. It's frequently not safe for them or other people on the road, but they're doing what they have to do because they have to get to the grocery store, the doctor. People need to be able to hear, to be able to interact, to be able to maybe have a job and have some extra income. All of those things are really dependent on those services, on those things being provided.
It's time this country had insurance, health care for all and in all phases of health care. They'll tell you it's time to get a colonoscopy to protect your health, but we're not going to have you go to the dentist and get that rotten tooth that's getting an infection into your bloodstream or let you go around deaf or blind. It just doesn't make sense.
All right. So that video gives us a really, again, just a great and powerful look at a couple of stories of how these policies would really change lives, right? So that's just a bit of a recap. Something else that I want to note about these expansion measures, I think someone was writing about this in the chat before, and that is that our opposition in the healthcare justice movement is terrified of these policies. There is a notable front group in the Medicare For All fight and the healthcare justice fight of the country's largest insurance, pharmaceutical, and hospital corporations. It's called the Partnership for America's Healthcare Future, the biggest front group of all of these companies. And they are spending tons of money right now opposing all 3 of these measures because they know that they're on the table and they know that they are going to threaten their bottom line, right? And we like things that threaten their bottom line. And it's a pretty good sign if they are fighting so hard, right, to oppose these things. They're going around lobbying members of Congress. They are spending tons of money on ads. They're doing op-eds in the Washington Post. They're making the rounds on major news networks talking against these policies. If they're spending that much of their time and energy opposing these measures, I think that's a pretty good sign that it's probably something that we should be fighting for. So that is a bit of a recap. Before I talk about sort of like the state of play in Congress and some of the folks we should be focusing on right now, I also just want to note, and I'm going to try and pop this in the chat here. One thing that we really want you all to come away with on this call tonight is just some really key talking points for how to kind of summarize and talk about these issues with your coworkers, your friends, your family, your neighbors, to be able to talk about these policies in the next few weeks and have that resource. So what I'm going to drop in the chat real quick is our talking points from NNU about these policies here. And that's just a short link there. So please do feel free to hold on to that link. So let's talk though about what's going on in Congress.
It is outrageous.
Sorry. There we go. Okay, so what's going on in Congress right now? Right now, where pressure is really needed in the next few weeks, honestly, is on Senate Democrats. Democrats in the House are also really crucial here. But I'll talk more about that in a second. But right now, the ball is really at play in the Senate. That's where the negotiating is taking place right now. Amirah talked about this before, but this package is being negotiated through a fancy word called reconciliation. You may have heard Senator Bernie Sanders talk about that word. That is a fancy way of saying that we only need 50 votes to pass this bill. And it basically means that we are not going to need any Republican support, which is great, right? But it does mean, unfortunately, we have some Democrats to move because even all of the Senate Democrats are not quite on board with all of these policies, and they're going to need to feel some pressure from us. A couple of folks in the Senate are most particularly central to this. I'm not going to talk about them all. I am going to talk super briefly about perhaps one of the most central folks, and that's Senator Chuck Schumer, who is majority leader of the Senate. He is pretty much the most central person to negotiating this package with President Biden and with his colleagues in the Senate. Amirah also said this, but a few days ago, we heard that Senator Schumer announced that he was going to be working closely with Senator Bernie Sanders on improving Medicare to include dental, vision, and hearing. He said that he supported that part of these policies. So what we need to do, right, is thank him for that. And we need to tell him loud and clear that that's also not enough, but at the very least, we need to really hold his feet to the fire on making sure that these things get included. It's great that he has moved on this and that he is supporting these things with Bernie. We need to hold him to that and make sure that he hears loud and clear that he needs to keep these things a priority and keep them in the package and make sure that they don't get negotiated back out by some of his colleagues who are less supportive of these issues. If you, for folks who are in the state of New York, although that's of course not anyone on this call, folks in New York are going to be able to be particularly impactful on Senator Chuck Schumer, but he is the Senate Majority Leader. So really anyone, anywhere in the country can help us put pressure on him, and that's going to be really key. Aside from Senator Schumer, there are other folks in the Senate on the Senate Budget Committee and the Senate Finance Committee who are going to be really central. I'm not going to go into those because none of them are in Minnesota. What I am going to talk about are two senators from the state of Minnesota. You are lucky enough to have two Democratic, lucky may not be the right word, but you in the state of Minnesota have two Democratic senators, and I'm going to talk about each of them one at a time real quick. First up, you have Senator Tina Smith, and she has expressed support for these measures, which is really great. And really what we need from her is to thank her for her support of these, to also make sure that she holds steady, right? That she knows and hears from Minnesotans about how crucial these are, but also call on her ask her to call on her colleagues to support these measures, particularly her other Minnesota senator, the other senator from the state, her colleague, Senator Amy Klobuchar, who is unfortunately not yet as supportive of these issues. Your other senator from Minnesota, Klobuchar, needs to hear from her constituents, needs to hear from Minnesotans about how important these measures are, and needs to be moved and pressured on this. So where we really can use your help, and I know Rose will talk about this more in a minute, but where we're really going to need your help is on, as I said, calling on Senator Tina Smith to thank her and ask her to move her Senate colleagues, and calling on Senator Amy Klobuchar to support these issues. That's the Senate. In Minnesota, you also have a number of members of the House who are Democrat members. Not all of your members from Minnesota are Democrats, but a good number of them are. You have Representative Angie Craig from the 2nd District, Representative Dean Phillips from the 3rd District, Representative Betty McCollum, who we talked about before, from the 4th District, and Representative Ilhan Omar from the 5th District. If any of these folks are your members of Congress, we're going to need your help to call on them. As we said, the House is not quite as imperative right now as the Senate, but it is still crucial that these folks hear from us. I want to note that Representative Ilhan Omar has been very central on the House side to negotiating on these things. She's in leadership with the House Progressive Caucus and has been publicly leading on this, and has noted publicly that Medicare expansion and improvement is a top priority of House progressives. So that is great. We're appreciative to her for that leadership. But even still, it cannot hurt for her to hear from her own constituents, to thank her for that work, and to hear, just underscore how important and life-saving these measures would be. If you are not sure which member, who your representative in Congress is, I'll drop a link in the chat, just a basic link where you can, if I can get that to pull up, where you can find your member of Congress if you are not sure who your member of Congress is. If you know that they're one of these 4, we're going to need your help. Okay, so that's a bit about the breakdown and some of the priority members of Congress. So what can you do? You're going to hear from Rose on this, as I said, in just a minute, but I want to emphasize real quick before I end that that telling stories is really going to be impactful in this fight in the next couple of weeks. As you saw in that Bernie clip that I played, that's really what's going to make a difference, right? Those kind of personal, direct to camera stories, they're really going to help us cut through the noise and show just how impactful these will be materially on working people's lives in this country, right? At NNU, right now, we are collecting stories, and we're following up with folks who have particularly compelling stories to talk to folks further who submit them to us about sharing them by writing a letter to the editor, by recording a video, like a selfie style video with your cell phone camera, or other ways. And I am going to drop a link in the chat to where you can submit a story if you feel like if you have one. So if you yourself feel like you have a personal story about how your life might be changed by these, if you're a nurse and you have a story about how this would change the lives of your patients, or if you have a loved one, a family member, a friend who would be impacted by any of these policies, we really, really want to hear that story. And what we may follow up with you, as I said, about ways to share your story publicly, because we really want to get those stories out in front of these members of Congress. And so I'm going to drop that link in the chat real quick. And please hold on to that link if you want to share that with others, or if you want to submit a story yourself. So that is was a lot, but we do have one more really concrete way that you can take action, and I think I'm going to pass it to Rose, who is going to cover that.
Okay, before we hear from Rose, we have one question in the chat, but I think I'm not sure if it's a Jasmine question or an Amirah question, but it was from Dawn asking, will this require any changes, increase with our Medicare monthly premiums? Do either of you know the answer to that question?
Sorry, I'm just looking to find the question. With this, sorry, Jerry, is the question, would this change Medicare premiums? Is that the question?
Would people who are current beneficiaries need, see some cost increase?
No. So what would happen is you would see, if we won the out-of-pocket cap, you would see a decrease in the copays you have to pay. So you'd see a decrease in your out-of-pocket spending. And if you are currently on traditional Medicare and don't have dental, vision, and hearing, or if you are paying more for a Medicare Advantage plan so that you have dental, vision, and hearing, dental, vision, hearing would then be included in traditional Medicare. So you could choose rather to give up your Advantage plan and to be in traditional Medicare instead. So those would be the main impacts.
Thank you very much, Amirah. And thank you, Jasmine, for your presentation. Now we will kick it over to Rose again.
All right. So now we heard the specifics of the policy proposal and the organizing strategy that's being put in place to make it happen. So let's take a minute to go back to those questions that I asked at the beginning and let's answer them. So the first question was, would this proposal strengthen the social insurance model? The answer is yes. I mean, we just cannot allow for the savings that we could achieve through the negotiation of drug prices in our public Medicare system to find their way into the pockets of the health insurers. They have more than enough of our public dollars as it is already. They don't need any more. We must capture these savings so that we can expand and improve traditional Medicare, which will expand and improve the lives of millions. Second question, would this proposal help to decommodify healthcare? Yes. Drug price negotiation alone is a step towards decommodifying healthcare. And if we improve Medicare to have a out-of-pocket cap, and we start to cover vision, dental, and hearing, which, by the way, are all connected to our health, as we heard in the video, it begins to recognize health as a human need and not as a commodity that is up for the highest bidder. This is important. So the third question was, would this proposal move us closer to Medicare for All? Again, yes. The Medicare for All Act of 2021, and if we assume that Senator Sanders, when he reintroduces the Senate version, hopefully this fall soon, of Medicare for All that he previously had introduced, both of those national bills include a transition period, a time when we would move from our currently dangerous and inhumane system to a patient-centered Medicare for All system. Achieving this proposal that you heard tonight on expansion and improvement only makes that transition easier to do. It is about building the infrastructure so that once Medicare for All is passed, we already have portions of the system in place and ready to go. The next question asked is, would this proposal help us build power and bring in new allies? Yes, it would. As Jasmine alluded to earlier, think of how many workers stay on the job, jobs that wear and tear on our bodies and our minds between the ages of 60 and 65, only because we can't afford health care that doesn't have our employers picking up some portion of the cost. We all know how ludicrous it is to tie employment to healthcare access. But that's why breaking away from that type of a system and allowing workers to retire with health and with dignity and with economic security, especially around healthcare costs, that would be a significant improvement, and it would most definitely bring more allies into our movement. And the final question, would this proposal help to weaken and divide the medical industrial complex and their allies? To be ridiculously Minnesotan, you betcha it would. The medical industrial complex will fight this tooth, I guess, and eyes and ears, but getting this done shows people how much better our system could be if we just get the unnecessary and superfluous middlemen out of our healthcare system. So fellow healthcare justice allies, the nurses say this would be an historic win for our movement. It isn't everything that we need and deserve, but as skilled negotiators, as well as practitioners, the nurses know when they see a step in the right direction, and this is it. So I'm going to repeat one more time what Jasmine laid out for us as the task at hand. Number one, call Senator Tina Smith. Thank her for signing the letter in support to President Biden for this proposal, please ask her to lobby her fellow senators, particularly the one from Minnesota, with her, and also to support this as well, and ask her to be more vocal about this. We want her talking about this out in front of folks. Tell us why she supports it and why it's going to be so important for her constituents to see this be part of the final American Families Plan. And then we get on the call to Senator Amy Klobuchar. We have to urge her to support this proposal. She did not sign on to that letter that Senator Smith did. It's important to make our voices loud and clear, because there should be no mistaking the fact that Minnesotans want both of our senators to support this proposal. So again, numbers were put in the chat. We can put them in again. NNU is making this really simple for us, whether it is the senators or, as Jasmine mentioned, even making sure we can shore up the House members to support this as well. So everybody, this is just a phone call. It's just a phone call right now. That's our chance. Let's not allow another golden historic opportunity to pass us by. Let's begin the path to Medicare for All by calling our congressional representatives and demand, yeah, I did say it, demand that they sign on to enact this life-saving proposal. We get a good portion of the expanded and approved taken care of, and then we get to move on to the for all portion next. So I want to ask you right now, are you going to join me in making these calls? Because I've already got one done. I got Tina taken care of. I'm taking care of Amy and Betty tomorrow. So I'm hoping that you will join me. And I also need you to get at least 3 friends and family members to make those calls too. Let's flood their phones. Let's have our voices be loud and clear and be heard, because this is our healthcare, this is our health, this is our lives, and it is up to us to fight for it. Si se puede, everybody. Let's get this done.
All right, thank you, Rose. We have some questions in the chat. We got some thumbs up coming in and some yeses. Questions in the chat. Yes, we can email talking points and phone numbers and so forth. If you signed up, when you signed up for this event, if you included your email address, we will send something out to everyone who signed up. We had a question about what's the incentive for drug companies to invent life-saving medications if their prices come down. And I am really happy to see in the chat that we already have some excellent answers to that. So I don't know that we need to spend a lot of time. We got some experts in the chat answering the question, but I do want to note, I put a link to a podcast that our friends at Healthcare Now did a couple of weeks ago on that very same issue. The short version is they don't spend very much on R&D. Most of the research and development and innovation is funded by taxpayer dollars. So that is a story that the pharma industry likes to tell, but it's not the whole story. We had a question about, would these proposals make Medicare, traditional Medicare, equivalent to silver healthcare plans? And talking behind the scenes, I'm not sure that we know the answer to that specifically. I don't know, Rose, if you have any ideas. I don't think our other folks were jumping to answer that one either.
I'm sorry, can you repeat the question again?
Yeah.
I can't quite follow. Yeah.
The question was, would these proposals make traditional Medicare equivalent to the silver level healthcare plans? I don't think so.
So the silver plans on the ACA, and Amirah is really our policy expert. I'm going to take a stab at this. The silver plans on the exchanges are 70-30 plans, right? So that means the insurance company pays 70%, you pay 30% out of pocket. Traditional Medicare is actually an 80-20 plan right now. So it's actually a gold plan, but it doesn't cover, as we've talked about, those important things of vision, hearing, and dental. So but neither does the silver or gold or even platinum plans on the ACA exchanges either. You still have to buy separate insurance for those other things. So the idea would be, would it become go from an 80-20 to plan to a 90-10 or a 100%? That's what we really want, right? We want a 100% plan. I don't think it gets to 100%, but if we cap out of pocket, expenses, it certainly is going to bring that 20% down pretty significantly. Am I kind of on par here when I'm saying this, Amirah? Does that sound right to you?
I think you're correct. I was just trying to refresh my memory on exactly the numbers on silver plans, but I think the real question would be if we capped out of pocket, so it wouldn't get worse, right? So assuming Medicare right now, and I think Rose, you're right, it's about an 80-20, that Medicare is not going to get worse, right? So it's still going to be better than a silver plan. It's still going to be like a gold plan. The question is, if we capped out of pocket costs, how much would we cap them at? And so that's a question, right? Like how much better would it get from its current level in terms of the split?
And it's definitely part of when we talk about anytime improving Medicare is we understand it's an 80-20 plan. That's why people that have traditional, they buy gap, right? Supplemental gap plans. That's why in Medicare for All, no more of that nonsense. The Medicare for All system takes care of everything. So you don't have to any longer buy anything to fill in a gap. It's already closed once we get to Medicare for All.
So we've got another question in the chat from Jean asking, during the pandemic and now in the Biden administration, former CMS leader Andy Slavitt has been a respected voice. He founded an org called US of Care, United States of Care. Prominent lawmakers look to him and this org, I believe. Are they an ally? I don't know that they are necessarily. What I've heard of Andy Slavitt, though, and I did just recently buy his new book, he, I think, has been radicalized a little bit by the pandemic, and he is much more willing to call out capitalism as a huge part of the problem. But I don't believe that that organization itself is an ally on this issue. Is that correct, Amirah?
Yeah, I would just say I haven't been looking at what he and US of Care have been saying recently on this, but they haven't signed on to any of the sort of national coalition things happening. So they're not an ally that I know of. Yeah, I will say that there is a pretty broad group of organizations that are working on this, which is really exciting. There was a letter sent out with more than 100 organizations signing it, calling for these three things, including a number of large unions, large organizations that don't actually support Medicare for All, that like aren't, we don't normally work with on this, but that are on board for these three reforms. So that is really good politically for us.
Okay, thank you, Amirah. Here's the letter. Jasmine put the link into the letter that has all of those organizations that are signed on. So that is very helpful. Thank you. We just have a couple more minutes left. So if there are any last questions for Rose or Jasmine or Amirah, now is your chance. If there aren't any more questions, we just want to thank all of you for making time on a sort of dreary Thursday, Wednesday? What day is today? It's Wednesday evening. Thank you so much for being with us. And another big thank you to our guests today, our speakers, Jasmine, Amirah, and Rose. And thanks to all of you we know you're going to make those calls, and we know you're going to get 3 of your friends to make calls too. So thank you so much for that work that you're going to do in advance. And with that, I think we can adjourn for the evening. Thank you so much, everyone.
Thanks, everyone. Make the calls, make the calls, make the calls.
Thank you. Jerry, can you give us the location for the recording? Since I had a huge issue this evening.
Yeah, we did record this evening, and it will get posted on the M&A YouTube channel, which I can put that in the email that we send out to everyone. But if you go to YouTube, just look up Minnesota Nurses Association, comes up.
Thank you so much.
That probably won't be there for another day or so. Takes a little
okay.
All right. Thank you, everyone.
Thanks again. Thank you, Jasmine and Amirah. It was wonderful to have